Welcome to McClendon Lab's Core Lab. I'm Becky Tauber, Lab Manager for our Core and Specialty Labs here at the Medical Center. Have you ever wondered what happens to your blood after it's collected at your doctor's office? Well, let's take a step inside the Core Lab and see where all the magic happens. This is our specimen processing and receiving area where we receive more than 6,000 specimens to be run in McClendon Clinical Labs through the pneumatic tube system or our receiving window each day. Every specimen is scanned and tracked by barcode by our front-end automation, and then it is routed by this line to be centrifuged, decapped, and directed to the right analyzer, all without manual handling. Automated chemistry and immunoassay testing is performed using these analyzers. These systems measure everything from glucose and electrolytes to hormone levels and cardiac markers, all connected seamlessly by automation. Our hematology section uses high-throughput hematology analyzers to provide complete blood counts and differentials. For abnormal samples, slides are automatically prepared, stained, and reviewed under the microscope by a trained scientist to look for abnormal cells that may indicate diseases such as anemias and leukemias. In coagulation, our instruments ensure accurate results to detect and manage bleeding or clotting risks. In our urinalysis area, we do many chemical tests looking for abnormalities like blood, protein, or infection in the urine. This instrument will perform dipstick testing on the urine, followed by an automated review of the sediment findings in your urine, looking for things like white cells, casts, bacteria, red cells. For rapid results on critical patients, blood gas analyzers deliver oxygen and pH data in minutes. This testing is often used to support patients who are in the ORs or in our intensive care units. Our laboratory scientists are able to monitor and control all of the automated analyzers from our command center here in the laboratory. They are also reviewing test results as they come off the analyzer and releasing them into the electronic medical record. Our scientists working in this area are also able to answer phone calls and consult with nurses and other members of the healthcare team with questions about laboratory specimens and their results in the laboratory. Our core lab is a fast-paced, technology-driven environment where every test contributes to patient care. Even with automation, expert review is critical. We report more than 12,000 test results a day in this laboratory. Highly trained staff evaluate non-routine results and call criticals or urgent findings directly to providers. After testing, specimens are held in refrigerated storage for up to 4 days to allow for physicians, after getting your initial results, to be able to order additional testing without you having to come back and provide another sample. This is a wonderful thing for patient satisfaction and patient care. Whether you're drawn to science, technology, or helping people, a career in clinical laboratory science could be your path. We need problem solvers, collaborators, and those who want to make a real impact in healthcare.
Hi, I'm Dr. Tara Moon. I'm the Division Director for Clinical Laboratory Science at the University of North Carolina, and we're here at the Transfusion Medicine Service at UNC Health. This is where I started early in my career and actually inspired my love for blood banking and transfusion medicine, and so I'd like to show you what it's all about. This transfusion service is very unique because it also includes an apheresis center where patients come. So the staff in the clinical lab at the transfusion service are involved in preparing products needed for apheresis for certain types of patients like sickle cell anemia, some cancers where they donate their own products for themselves or others that are going to be used later, or some other hematologic conditions. This part of the clinical lab involves collaborating with other healthcare professionals in addition to the laboratory professionals, so they work together to provide products for these patients. This is the compatibility part of the transfusion service. Before any transfusion, we have to ensure that the product that's going to be transfused to the patient is compatible. So we do lots of different types of testing to ensure patient safety, so that it can include things like a blood type, an ABO/RH, a cross match between the donor and the recipient, or an antibody screen where we look in the patient's plasma to see if they have any antibodies that may react with the recipient. Much of the testing that we do for compatibility is still very manual. We use test tubes and agglutination viewers and have to do a lot of problem solving and troubleshooting, especially when it's a very complex patient. We also have some automation in this space to use, but it's mostly for routine testing. When it comes to an acute situation where a patient's in need of having products very quickly, we still revert to the manual methods. That's still the quickest way to get them a blood product in a time of need. This is an example of an automated analyzer that might be used in a transfusion service. We use the automated analyzers mostly for routine testing, things that are scheduled in advance, maybe an elective surgery that's a couple days away, or sometimes for prenatal screening for obstetric patients. These are examples of 2 blood products that patients may receive, red blood cells, or they might receive just the liquid part of our blood, what we call plasma or fresh frozen plasma. Before every transfusion, we are really careful to make sure that these products are stored properly at the right temperature, and that's regulated. These products are tracked all the way from the donor center, wherever they are collected, and monitored when they get here for their temperature to make sure that the patient receives a safe transfusion. This is another example of a blood product that a patient might receive. These are apheresis platelets. So this is the part of your blood that helps your blood clot when you might be bleeding from an injury or for some other reason. We have lots of patients at UNC Health that need platelets: cancer patients, burn patients, patients that have had a procedure or in the operating room or have had some kind of trauma often need platelets. It's a product that's always at a critical inventory. So our transfusion service at UNC is constantly recruiting for platelet donors and even has their own platelet donor center. We are in the components area of the transfusion service. In addition to processing all of the products that patients need for transfusion, this is also where they get signed out to the patient bedside. So another member of the healthcare team will come to this window behind me and bring the patient's information. We will compare that to what we have labeled the product with and make sure that there's a clerical match, that the right product is going to the right patient. We have to be really careful about that. Normally, we'll just sign out 1 unit of a product at a time, but in some situations, like acute situations in certain settings, like the ER or the operating room where a patient is in crisis, we might sign out multiple units of a product at one time. So we'll pack up a cooler with ice and send multiple units so that the patient can receive them very quickly. Like any part of the clinical laboratory, the laboratory professionals that work in the transfusion service need to have a lot of attention to detail. They also need to be always thinking about the patient. It's a part of the laboratory where we can have a very immediate and direct effect on patient lives. The laboratory professionals that work in the transfusion service are saving lives every time they do a cross-match or sign out a unit of blood.
Hi, I am Cher Wilson. I'm the manager of the Microbiology Lab here at UNC Hospitals in Chapel Hill. Have you ever wondered what happens to that throat swab that they take at the doctor's office, or that COVID swab? Well, let's go find out. Come and follow me, and I'm going to show you the Microbiology Lab and what we do here. This is one of the entry points for almost 1,000 specimens a day received here in the microbiology lab at UNC hospitals. The sample is scanned into our computer system and a unique number is given to each patient and their sample. A label is then printed to be used in the next step. The next step is for the technologist to pick an agar plate that complements the type of test that's being run. Agar contains nutrients for different organisms that help them grow so that we can identify them. The specimen is then added to the agar plate. Once added, a sterile loop is used to perform streaking for isolation, which allows the next technologist, once the organisms grow, to find a single colony that helps us identify them easier. This is the Keystra, also known as total laboratory automation, or affectionately known as the robot. It allows us to process all of those samples faster than we would be able to if we did it by hand like you saw earlier. The robot can take the samples, scan the barcodes that were placed on them earlier, it knows what agar plates to pull, it pulls them, it then utilizes a metal bead and a magnet to create those cool streak patterns and then transports it via an automatic line to incubators where the organisms can grow if they're there, and at intervals pictures are taken, which allows our technologists to look at them further. Once the bacteria has a chance to grow in the incubators, it will take pictures of the plates at different intervals. The technologist can then retrieve the pictures on a computer screen and analyze them to see if anything looks interesting or amiss, something that we might need to investigate further. The other thing that we do is help the physicians know which antibiotic to give. We do that by growing the bacteria on a plate and then putting a strip with antibiotic in it to see if it will kill the bacteria around the strip. This one shows that this bacteria can be treated by that antibiotic. Here is another version of that antibiotic test. This is a green Pseudomonas, and it has multiple antibiotic discs on it. So this antibiotic would be the best drug to give this patient because it killed the most bacteria. Bacteria can have different colors, different size colonies, different shapes of colonies, and those different agars that have different nutrients grow different bacteria. These are some examples of really cool colors, some more colors, some different bacteria with different colors and shapes. This one has a bullseye in its colony. And this shows you why we did that streaking pattern. So we can streak for isolation and go in and get just one single colony to help us identify which infection this patient has. In the microbiology lab, we don't just look at bacteria as causes of infection, we look for other causes. One of those is yeast. And just like the bacteria, it can have different colors and shapes of its colony. Another one that we look for is mold or fungi. And those can really get funky, like this blue-green one, this white and black spore-laden one, and we keep these lids on to protect us from the spores. This one is yellow and brown and very bumpy. And the last one is just one single black colony, fuzzy black colony, none of which are good. Another type of infection that we look for in the microbiology lab is a parasitic infection, and this is an example. This is an Ascaris worm. It is a roundworm, and it is from a patient who was a farmer and did not wear shoes while walking around a pig farm. Another parasite that we see commonly here in the special microbiology lab is a blood parasite that you may have heard of, and it's the parasite that causes malaria. And as you can see up on this screen from this slide that I'm looking at, we have white blood cells. Those are your immune cells. We have red blood cells that look nice and normal, but then we have a blood cell that has something in it. And that is the organism that causes malaria. Well, that's it. I hope you enjoyed your tour of the microbiology lab here at UNC Health, main hospitals in Chapel Hill. We do a lot of really cool work here, as you can see, but we also have a lot of fun. We decorate for the seasons, as I'm sure you've seen during your tour. We celebrate milestones, birthdays, babies, weddings. We have a lot of fun together. So, thanks for visiting.